High blood pressure is often called the silent killer. It creeps in quietly, causing no symptoms at first, yet it's one of the leading causes of heart attacks, strokes, kidney failure, and even death worldwide. Millions of people walk around every day without knowing they have it. But once you understand what hypertension is, why it happens, and how to manage it, you gain the power to take back control of your health. Your blood pressure is essentially the force of your blood pushing against the walls of your arteries as your heart pumps. It's measured using two numbers. The first, called systolic pressure, is the pressure when your heart beats. The second, diastolic pressure, is the pressure when your heart rests between beats. A normal reading is usually around 120/80. When your blood pressure consistently rises above 130/80, that's when we begin talking about hypertension. At first glance, high blood pressure might not seem like a big deal. There's no pain, no obvious discomfort, no warning bells. But inside your body, something dangerous is happening. The increased pressure damages the lining of your arteries over time. Tiny tears form, where cholesterol and other substances start to accumulate. This builds up plaque, leading to narrower, stiffer arteries. Eventually, this leads to conditions like coronary artery disease, heart failure, stroke, and kidney damage. There are two main types of hypertension. Primary, also called essential hypertension, is the most common and develops gradually over many years without a specific cause. It's influenced by genetics, age, lifestyle, and diet. Then there's secondary hypertension, which appears suddenly and is caused by an underlying condition such as kidney disease, hormonal disorders, or even certain medications like birth control pills, decongestants, or pain relievers. While it's often symptomless, some people with very high blood pressure may experience headaches, dizziness, shortness of breath, nosebleeds, or vision problems. But these signs usually don't appear until the pressure is dangerously high. That's why regular monitoring is key. A simple blood pressure test at a clinic or even at home with a cuff can reveal a lot. Risk factors for hypertension include being overweight or obese, a sedentary lifestyle, smoking, excessive alcohol use, high salt intake, stress, and of course, genetics. Age plays a role too. Blood vessels naturally become stiffer as we grow older. Men are generally at higher risk at a younger age, while women catch up after menopause. Once diagnosed, the management of high blood pressure begins with lifestyle changes, and these changes are powerful. Reducing salt intake, usually to less than 2,300 milligrams a day, can significantly lower blood pressure. The average person eats far more than that, often without realizing it. Most of the salt we consume doesn't come from the shaker, it's hidden in packaged, processed, and restaurant foods. Diet plays a crucial role. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while cutting back on red meat, sugar, and saturated fats. Even small weight loss, around 5 to 10% of your body weight, can make a noticeable difference. Physical activity is another major tool. Regular aerobic exercise such as walking, cycling, swimming, or jogging strengthens the heart, allowing it to pump more efficiently and with less force. This lowers the pressure on the arteries. Just 30 minutes of moderate activity 5 days a week can make a real impact. Reducing alcohol intake, quitting smoking, and managing stress are also key. Stress might not directly cause long-term high blood pressure, but it often leads to habits that do, like overeating, smoking, or drinking. Techniques like meditation, deep breathing, or even spending more time outdoors can help calm the nervous system and reduce the intensity of blood pressure spikes. When lifestyle changes aren't enough, medication is often necessary. There are several classes of blood pressure drugs, each working differently. Diuretics help the body get rid of excess salt and water. ACE inhibitors and ARBs relax blood vessels. Beta blockers reduce the workload on the heart. Calcium channel blockers help relax the muscles of the arteries. Doctors often prescribe a combination of these to get better control. The important thing is to stick to your prescribed treatment. Blood pressure medications are often long-term, and stopping them suddenly can be dangerous. Uncontrolled hypertension doesn't just affect the heart and arteries. Over time, it can damage the tiny blood vessels in your kidneys, reducing their ability to filter waste. It can also harm your eyes, leading to vision problems or even blindness. And in the brain, it increases the risk of aneurysms and strokes. That's why even if you feel fine, treating high blood pressure seriously is non-negotiable. Monitoring is key. Home blood pressure monitors are widely available and easy to use. By keeping a record of your readings, you can help your doctor make better decisions and catch changes early. Always measure it at the same time of day in a relaxed state, with your arms supported at heart level. One of the biggest challenges with hypertension is that people often don't take it seriously until a major event like a heart attack or stroke occurs. But prevention is far more powerful and far less painful than recovery. Small daily habits like skipping salty snacks, choosing water over soda, getting in a short walk, or sleeping a bit better, all add up. Education is the first step. When you understand how high blood pressure works and how it damages your body, you begin to see it not as just a number, but as a warning. A signal that your body is under pressure, literally, and it needs help. The good news is that hypertension is one of the most controllable risk factors in modern medicine. With awareness, testing, and lifestyle changes, millions of lives could be saved. If you haven't had your blood pressure checked recently, take that step. It's quick, it's painless, and it could quite literally save your life. And if you've been diagnosed already, don't ignore it. Take action now. Because when it comes to hypertension, silence isn't peace. It's danger waiting to strike.